Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Housing, Addictions, and Homelessness. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Portage La Prairie.
Thank you, Honourable Chair. I just want to point out, first of all, that we're 10 to 4 here today. We've been waiting over 45 minutes for the minister to get here. We're hoping to close out today, but we do have a number of questions that we'd like to continue asking. So I'll start right away here. The minister has tried to tell Manitoba that...
Order. Just a general reminder to all folks, the estimates room is an extension of the chamber, and we are not permitted to comment on one's absence or presence. So please don't do that again. Thank you. The honourable member for Portage.
I withdraw that comment. The minister has tried to tell Manitoba that youth won't be able to access the drug consumption site, but internal documents from Aboriginal Health and Wellness show why no one believes a thing that's being said. Her department is funding this site, so if she's planning on helping youth shoot up, why did she have Aboriginal Health and Wellness generate a youth intake form?
The honourable minister.
Miigwech, honourable chairperson. So that member, continues to use rhetoric around discrediting the, incredible work that Aboriginal Health and Wellness has been doing for, decades in the community around healthcare. They have a proven track record and, in the community, trusted in the healthcare field by healthcare experts, whether that's in the addictions field or, the healthcare field, primary healthcare. They operate a clinic in the Niiganan Centre. They also offer a RAM clinic in the Niiganan Centre, a mobile primary health care clinic as well. They do such amazing work. So I would, say to the member that that member should maybe go for a visit instead of, throwing stones at them. And that member continues to throw stones at folks and services that they've never actually gone to visit and actually have a conversation with and actually get to know what kind of services and supports that these organizations offer. So as far as the youth accessing the supervised consumption site, youth will not be able to access the supervised consumption site. I've been very clear about that from the very start, that if a youth presents at the supervised consumption site, that they will be redirected to appropriate services. There is an intake form, yes, and that is to redirect to the appropriate service. If someone presents there, you want to know who they're being redirected to. Ray is a great example, and again, I would invite that member, he's the critic for addictions, housing, and mental health. I don't know how many of these service providers that he's actually gone and visited. Has he actually gone and met with Ray? Has he gone and met with the overdose prevention site, Sunshine House? Or is he just going and doing the looky-loo like his predecessor did, the former Minister of Mental Health and Wellness, Sarah Guimard did? Apparently went to Vancouver and visited a supervised consumption site, but just took pictures and didn't actually go inside and actually look at and talk to the service providers at the site. So, I would invite that member to actually go and get to know what those service providers actually provide. Maybe go and meet with Aboriginal Health and Wellness and talk to them about what services they provide, and what the supervised consumption site is going to provide. Maybe that's a starting point for that member. He's been at every supervised or every consultation. Is he not listening to what members are talking about? I've outlined no youth will be accessing those services several times at the consultations, several times in the House. Aboriginal Health and Wellness has also said that no youth will be accessing services at the supervised consumption site. And if a youth does present there, that they will be referred to the appropriate service, not the supervised consumption site. So I would invite again that member to look at what appropriate services are out there for youth that are seeking addiction support services. We had several service providers that were in the Rotunda today. Huddles are an amazing service provider that offer mental health, addiction support, primary health care. That member is, going to have one in their very constituency. So I'd invite that member to maybe go and visit and get to know what Huddles have to offer. Such amazing resources, such amazing folks that offer a plethora of services to youth. And, those are the services that will be provided to youth who present at, the supervised consumption site if a youth presents there. So again, that member can, try to, mislead members of the public, but
Before introducing the next member, we just want to remind all members that here during estimates, it's an extension of the chamber, and we can't imply whether someone was being truthful or not. So I'll just ask the minister to withdraw those comments.
withdrawn.
The Honourable Minister.
Withdrawn.
The member for Portage La Prairie.
Thank you. First of all, I'd like to say that the last time I tried to go into a government building in Portage La Prairie, the new Portage Hospital, I was actually thrown out and told that I wasn't allowed in that building. So my next question, Honourable, it's not just a form, there's a whole youth service policy in the internal documents. The plans for helping youth take drugs come right after the section on pregnant women. And I will quote, "Youth appearing to look between the age of 16 and 18 will access the supervised consumption site," end quote, and goes on to qualify this access. Not youth with will not be permitted to access the site. Not ID will be checked, just if the person at the front desk thinks you might look 16. Is this minister going to force this policy to change? And why was it found alongside a personal letter of support for this project? Did the minister not read the operating procedures before signing off?
The Honorable Minister.
Miigwech. Again, I want to reiterate that no one under the age of 18 will be allowed into the supervised consumption site. We are working very closely on policies and procedures with Aboriginal Health and Wellness, and they are in line with the policies and have reiterated that they will not be allowing youth under the age of 18. They will be referring youth under the age of 18 to the appropriate services. And I'm not sure what the member, is not hearing about this. Again, they can have a conversation with Aboriginal Health and Wellness. The policy is youth under 18 will not be accessing services at the supervised consumption site. They will be meeting the federal requirements, and again, the exemption will be coming through the province, and our expectation, which is the same expectation of Aboriginal Health and Wellness, that youth that are 18 or that are under 18 will be referred to the appropriate services. And again, I would invite that member to set up a meeting if they would like with Aboriginal Health and Wellness. Go for a visit their RAM clinic, visit their primary health clinic, maybe go on a ride with their primary health care mobile unit. Like, they are doing amazing work. They are doing the work. They have the trusted work reputation of the community, and again, decades of work from the community, in the community. And what I would say to that member is, there was a public health emergency issue today around, the increase of HIV in our province. This is why it's so important that we get a supervised consumption site opened up in our province. We have a rise in HIV, and people need a safe place to use and get connected to primary health care. They need to, ensure that they are aware of PrEP, that they can have access to a primary health care provider that can get them connected to PrEP, and again, that they're not spreading HIV, that they can get tested for STBBIs, and this is a place that will do that. And again, primary health care is, a place where this will be provided at the supervised consumption site. Another service that will be provided there is housing, and we know that housing is a social determinant of how well people do. And under the former failed PC government, they were selling off housing. We're making sure that folks are able to access as much housing as we can. We put 2,183 units online of our Manitoba housing that were boarded up under the former failed PC government. We're making sure that folks are getting wraparound supports. 223 people from encampments are getting wraparound supports. That means that they're getting access to mental health supports, to addiction supports, getting reunified with their families, breaking cycles, going back to school, getting into the jobs field. These were folks that were, left to their own accord, just abandoned by the former PC government, that were left to, just in tents without anything. And our government is saying, you have value, you're sacred, your lives matter, and we're going to help you, we're going to support you, we're going to help you get back on your feet, and we're going to give you the supports you need, because we know that this isn't the life you choose, that you need a stable place, you need someone who's going to believe in you, and we're going to provide that. And that's a basic necessity that, human right that we can offer. And, the failed PC government failed to do any of that.
The member for Portage La Prairie.
Thank you, Honorable Chair. I just, just to mention to the Minister, I had the opportunity to spend a number of hours at a RAM clinic last week during constituency week. And something that really broke my heart when I went in there was a wall. And it was a wall full of people, or full of names of people that had died. They had died because there was no opportunity for any recovery or treatment for those people. We're seeing recovery, movement to recovery in treatment in BC. We're seeing it in Alberta. We're seeing it in Ontario. And again, when I read things like this Aboriginal Health and Wellness Centre, Appendix S, participant visitor form, and see the things on there, and one of the things that I want to point out on this form is, are you currently interested in addiction treatment options? There's one place for yes, but there's 4 other boxes there that have the word no in it. So are we trying to provide help for these people in the form of recovery and treatment? It is showing in the budget that there is that the amount of money being spent on the drug consumption site, the mobile drug consumption site, and the proposed consumption site at 366 Henry far outweigh what is going into the, is far outweighing what could be going into recovery and treatment. As I've said before, and I missed this week's graduation at the Bruce Oak Centre, but I can remember Scott Oak saying to me when I was there one day, when I said to him, I said, what do we need here, Scott? And he said, we need 10 to 15 more of these places. And I agree with him on that. So again, some of the things that are being asked from this participant form, and where I get into this is what drugs were brought today. And the minister mentioned, and I have spent some time at 631 Main Street. The minister said that I was a looky-loo. No, I spent time with a business person there, that business person actually took quite a beating. And she took a beating because all she asked was the 4 or 5 dealers that were standing on her doorstep, because they've got a crowd right there. The crowd is right there. You've got somebody, a captive audience. And all she asked was for them to move off of her doorstep. And what ended up happening was, like I said, she took a beating. But the other side of this too was, when I talked to her, I mentioned to her, I said, is there not security there? Because my understanding was at the drug consumption sites, there's supposed to be security as well there for instances like this. And there was not. Not that she saw. I asked her if the police were called. Yes, they were. But they had not shown in the time that she said. So again, I haven't been, and I'll say that, I haven't been to every drug consumption site, but 631 Main is operating right beside the Red Road Recovery Center. In fact, it's at the same address. We did have some staff that were there because there was an announcement a couple weeks ago And
Members' time has expired. Is there leave for the member to have an extension on his 5-minute allotment for questioning? Leave has been denied. The Honourable
Timer
Minister.
on the TV right there. That's what I'm looking at.
The Honourable Minister.
Honourable Chairperson. So first of all, I just wanted to go back to that application that, which isn't really an application. So that member is really doing a disservice by referencing that application. That was never a true application. So, and then, you know, referencing himself as if he's a medical expert and putting himself over, you know, the credible experts of Aboriginal health and wellness who have, you know, years and decades of experience in this field, who, you know, have, like I've said, ran a RAM clinic, have provided primary health care service for decades, who are leading experts in this area, I might add, who have experts in addiction services that are helping to advise and do this work alongside them. So, you know, that member is referencing a non-application. So I just want to put that on the record. Second thing I want to reference is that we take a balanced approach on this side of the aisle in our term of government, unlike the failed PC government, who took one approach, which was not a harm reduction approach. We believe in meeting people where they're at, because you can't treat someone who isn't alive. And you know, meet people where they're at, and to ensure that if, you know, today's the day that they decide to get into recovery, that recovery is there for them, which is why we're spending up to $90 million annually in addictions treatment, which is way more than the previous failed PC government ever spent in their time of government. So when they're talking about, you know, treatment, they spent way less money than our government is spending today. So for them to even, you know, talk about, you know, our government and our spending on treatment, we're taking a balanced approach. We're spending more money on treatment than they've ever spent, but we're also taking a balanced approach in terms of education, ensuring that we're making sure kids are getting to school, reaching their 18th birthday, putting, you know, things in place so that kids are, you know, enjoying recreation, families are enjoying time together, families are, you know, having food on their table in terms of affordability measures we're putting in place. We're also ensuring that we're working alongside policing, so enforcement, the meth task force, ensuring that we are getting drugs off the street, that we are tough on crime and tough on the proceeds of crime. And then again, a harm reduction approach, because you can't treat people who aren't alive and lead them to recovery. So when that member's talking about addictions treatment, we are investing more money than the previous failed government ever did. I wanted to go back to that form that member is talking about. Of course we would want to know if someone would want to get into treatment, and we would want to make sure that they would get into treatment and they had access to treatment, which is why Aboriginal Health and Wellness would want to ask that question. Why wouldn't we want to ask anyone that question? And that member would know with Bruce Oak that that is a question, or Scott Oak, that they, ask often, is today the day that you want to get into treatment? And if that's the day, their door is open, and they, aren't a place where they ask, do you have the money to be able to access our services? Because that isn't what it's about for them. For them, it's about life-saving supportive treatment. And that's exactly what our government is about, ensuring that the supports are there when folks need them. I want to go back to that wall. I visited that Portage RAM clinic as well, and it's very concerning. Whenever we see, names added to that wall, which is why we need to get that supervised consumption site open. So we can get people to the supports and services that they need, which is why we've added more supports and services into the system, which is why we've invested up to $90 million into more support so people can get into treatment and recovery.
The honourable member for Portage La Prairie.
Thank you, Honourable Chair. I want to go back to the form again. The appendix asks the Aboriginal Health and Wellness Centre. So I just want to get on the record that because this form was filed with the federal government, but the minister is saying, no, this was not. I just want to check on that. Number two, did I just hear also that there will be a drug consumption site in Portage La Prairie? That was my second question. But I also want to go over this form somewhat as well, too, because we talked about, the minister talked about treatment. It says here, and this is one of the questions on this form that the minister said has not been filed with the feds. So are you currently interested in addiction treatment options? There's one place for yes, but there's not at this time, no, and not applicable. So again, that's on this form that was given to the federal government, unless, as the minister said, it wasn't. So if she could say that on the record, that this wasn't there. And the second thing is to ask, is there a plan for a drug consumption site in Portage La Prairie? Thank you.
The Honourable Minister.
Miigwech, Honourable Chairperson. And again, I will ask that member where they got their medical degree in addictions medicine, why they think that they could be, referencing, this application. And again, we have taken over the class exemption, and we are working very closely with Aboriginal Health and Wellness on the exemption. And again, we are taking a balanced approach. It's a four-pillared approach, which is enforcement, so ensuring that we are tough on crime, proceeds of crime, getting drugs off the street, ensuring that we are taking a harm reduction approach so we can meet people where they're at. We can't treat people who are not alive. We're leading them to the supervised consumption site, which will be in Winnipeg. at 366 Henry. With her partner, Aboriginal Health and Wellness, who will be leading that work, who is a leading health expert, who is working with Dr. Kamisha, who is a addiction specialist, health expert, along with many other health experts in the field. And then we are also working from an education perspective. That is a balanced approach. Again, we are investing up to $90 million annually in addictions treatment, way more than the previous failed PC government ever did. We are ensuring that we are getting housing online so that we can support people in, whether they're substance use disorders, whether they have mental health issues and they need supports there, whether they need, housing and need to be stabilized. Whatever it is that they need to stabilize in their housing, we are doing that work. We are building housing, something that the previous government never did. And again, a generational investment. Former government never built one single social housing unit in their 7.5 failed years in government. We are ensuring that we are meeting people where they're at. Today, we proclaimed Mental Health Week. We had several amazing mental health providers who are in the Rotunda that are doing amazing work supporting people and meeting them where they're at, whether that's from a harm reduction lens, a mental health lens. They are, doing life-saving work. We announced, the investments to clinic that is life-saving work and bringing down the wait times. And I want to go back to the RAM clinic. Under the former PC government, we've brought down the RAM wait clinics by almost 50%. And that's a testament to the investments that this government is making, because we believe in, again, meeting people where they're at, providing the supports that they need. We brought over 1,200 new support services online. Anywhere in Manitoba, people can access RAM digital virtual services online, and we brought in mobile withdrawal services in the north, so people can access those services as well. We're working with Indigenous providers right across our great province. We're working on our suicide prevention strategy. Again, we've done extensive consultations right across our province, listening to, Manitobans to address, the high suicide rates and look at what needs to be, supported from folks in the communities. And again, we're making huge investments based on what communities are telling us. It's not our work, it's their work. We're not going to take credit for it because it's what they're telling us. They're the experts. We're just, basically doing the work of what they're telling us to do. So again, the supervised consumption site is going to be filled with primary health care, mental health supports, housing supports, and it's a medical-led model.
The Honourable Member for Portage.
Thank you, Honourable Chair. So again, this form from the Aboriginal Health and Wellness Centre is not my form. This was a form that was filed in the package to the federal government. It is not my form here. I do want to again ask the question because it's very important to my community. Will the minister admit today, yes or no, whether there is a drug consumption site going in Portage-La Prairie? The other question I have, or the other comment I have, is we have one detox bed in Portage-La Prairie. Is there plans for more detox beds in Portage-La Prairie? And when and where will they be?
The Honourable Minister.
Miigwech, Honourable Chairperson. So again, I will go back to that form that member keeps referencing, and will bring that member back to focus on Manitoba taking over the class exemption. We are taking on the class exemption. So that form is irrelevant. I just want to point that out, and that member is not a medical expert, and so we are, again, taking that over. That is irrelevant, that form that you are referencing. So I want to bring you back to the conversation of the consultation at Pampanga when you referenced MDC and maybe opening up a supervised consumption site at MDC. Our government is focused on Winnipeg and opening up a supervised consumption site here in Winnipeg at 366 Henry. We will not be opening up a supervised consumption site in Portage-la-Prairie, so supervised consumption site will be opening up in Winnipeg at 366 Henry, not in Portage-la-Prairie. I do want to bring your attention, though, to some investments that we have made in Portage-la-Prairie around homelessness and some of the stats that we've made. So we've funded the Portage Community Revitalization Corporation to the tune of $310,000 annually for intensive case management and rapid rehousing services, as well as the Canadian Mental Health Association for $55,000 for a homeless outreach mentor. So between these two agencies, they've actually housed 55 people in Portage-la-Prairie who are experiencing homelessness. So I think that, speaks to, the great work that those folks are able to do in terms of housing people and supporting folks. Portage also has a mobile withdrawal management service that is able to support people and provide services to the community in and around. And up to 75 people. And again, meeting people where they're at, providing those services to people in and around Portage. And again, we're going to continue to support and meet people where they're at, because we believe in, not just one approach, but a balanced approach. That's why we put more services online, why we're continually, ensuring that people that are housed are getting wraparound supports, and we're continuing to put more housing online, something that the previous failed government never did. They de-invested in maintenance by 87%. And only in the last year, in the election year, did they increase maintenance, trying to buy votes, increase the budget for maintenance. But Manitobans, saw past that and voted, to elect a government that would support Manitobans and bring housing truly online, build housing, and support Manitobans in a way that would see them successful, not just short-term but long-term. And when we look at the generational investments that our government has made, it's breaking cycles for families. It's creating, possible generational wealth in future for families. I think about, I was talking to Minister Chartrand, the federal minister, and they were talking about they are the first in their family to leave generational wealth. And we were talking about this is the kind of, future we want to see for, future generations, and the kind of work that we want to do to ensure that, Manitobans are better tomorrow than they are today. And that's the kind of government that we're what we're doing, the work that we're doing today.
Member's time has expired. The Honourable Member for Portage La Prairie.
Thank you, Honourable Speaker. Sorry, Honourable Chair. You know, I'd really like to hear, I've heard I've said this about the drug consumption site at MDC. The one thing I will say about MDC is we're waiting and waiting and waiting and waiting in Portage La Prairie. This government keeps saying that they're going to do something with MDC. There was a meeting again last week. Absolutely nothing was decided on MDC once again. There's a lot of beds there that could be a great treatment center. There is a ton of places there that people could learn trades like carpentry or plumbing or painting. It would be a fantastic site. But again, none of that is coming up at this time. So again, in our time here, so if we do get a chance to finish today, I do have some questions regarding housing. The minister has insisted she has stopped the practice of tenanting high-risk individuals in senior housing. But clearly from the chaos seniors are living through, that isn't true. Criminals, drug dealers and users and vandals are getting ready access to homes of seniors, and this government seems indifferent. Where in this budget are the supports for the seniors this government has placed at risk? We've only seen that in the media over the last little while. I think it was the building on Kennedy where the Free Press said in the site where a person lost their life, that in that apartment, it was also reported that there was butane, propane, gasoline in a jerry can. And thank goodness that wasn't any worse than what had happened there. We've seen it in Oak Tree Towers. The Stevens Apartments in Portage La Prairie, again, are another place that, and again, from what I'm hearing from the tenants, when I was there again last week, and the tenants now are down less to 15 people in the Stevens apartment. And the minister said that the work was going to begin on there in next year, I believe it is. But that place has been for over 2 years. They've been begging for work to be done in there. I know it's run by the Friendship Center in Portage La Prairie, but they also have told me that the same thing, that there's not many people that are working, that are living in that place. So again, I ask, where in this budget are the support for the seniors that are scared to open the doors in their apartments, scared to go out anywhere in their apartments? Where's the money for that? Thank you.
The Honourable Minister.
Miigwech, Honourable Chairperson. So first of all, I just wanted to, this is probably interesting for the member for Gimli and Interlake. Just wanted to let them know that there's around 400 people that are being served through the mobile withdrawal management services out in their community for addictions withdrawal management services as well. So lots of work being done right across the province to support folks around addiction services. So when that member is talking about, you know, supports for folks, it's happening right across our province. So I will go to Stevens, and as I told the member last time we were in committee, that Stevens apartment is slated for a $13.4 million upgrade. Under the former failed PC government, that member is right. That apartment was, those members were begging that failed government to upgrade their apartment. They needed renovations, extensive renovations, but the former failed PC government wouldn't do anything around renovations for any of government apartments at all. So our government has stepped in and stepped up, and we are investing $13.4 million into interior and exterior upgrades, mechanical and electrical systems. And as I told that member, that is slated to start this year in the fall. And as I said to that member, why would we start tenanting people and then move them out? That's very disruptive to folks, to tenant them for a couple of months or a few months and then upheave them and move them, you know, within a few months. It's you build an ecosystem with people, you know, in a building. So we have not tenanted people because we know that work is going to be happening in this building. As far as our policy around seniors, the failed former PC government changed the policy in 2022 around seniors buildings and allowed anyone who wasn't a senior to start tenanting these buildings. That put you know, seniors into unsafe conditions. And when we formed government and started to, you know, realize that this was putting seniors in these unsafe conditions, we reversed this practice and this policy and started to ensure that these seniors buildings went indeed back to seniors buildings, because seniors should live with seniors and should enjoy, you know, a life with safe and secure living conditions with, you know, people of their age. That's what they signed up to live in these buildings. And, you know, for the former failed PC government to, you know, change that policy without even having conversations with these seniors that were in these buildings was, you know, very callous of them. These seniors, you know, were very scared, were very frightened, were, you know, put in very unsafe living conditions. Not only that, but the failed PC former government also fired security guards, the very security guards that were employed in these seniors' blocks to support and provide security in these buildings. So seniors were left, you know, with people that were living in these buildings that weren't seniors, now left without security, and then also they were left without supports because now tenant service coordinators were also fired from Manitoba Housing. Maintenance workers were fired as well. So common areas were closed because they weren't maintained, and this was under the failed former PC government. So when that former PC government wants to talk about, seniors, I'll stand up every day and talk about our record.
The member for Portage La Prairie.
Thank you, Honorable Chair. I will say if we are going to close this tonight, I do have a couple more questions, but a couple things. First of all, unless the people that have just moved into Oak Tree Towers are looking very, very good for their age, I would say there is a number of younger people that are living in Oak Tree Towers. In the past, the minister told me, and I quote, "We've invested $5.2 million in Oak Tree Towers." I filled out the FIPA. Turns out it took the minister over 150 days beyond the legal time frame to find the records, and it was only $22,075.68, or 0.4% of what the minister said. What is 99.6% between friends? It's almost spot on. If this is a disagreement on facts, who does the minister want my constituents to believe? Her or her department?
The Honorable Minister.
Miigwech, Honorable Speaker. So when that member did their FIPA request, they did their FIPA requests for the time period of March 1st to May 26th of 2025. So that was a spending period for 3 months. So that amount that that member would have received would have reflected that amount. In fact, the amount that has been spent to date on Oak Tree Towers is $4.7 million in upgrades to security. I will go to Oak Tree Towers. I know that the member had organized a meeting in February with members at Oak Tree Towers, but failed to show up. So, that's, not very professional to organize a meeting with your constituents at Oak Tree Towers and then fail to show up with members, organize a coffee house, your members show up, your constituents, and then you don't show up to a meeting. We've done, several upgrades to this building. We're going to continue to support these members. These were upgrades that these residents were asking for from the failed PC government, that the failed PC government never acted on. When we got into government, we, of course, looked at what security upgrades and what needed to happen at this building as we did and assessed all of our properties within our envelope of Manitoba Housing, and we prioritized what needed to be done, and we made the investments because, this is a crown jewel, and we know that Manitobans deserve to have safe and affordable housing, and they deserve to have a government that is going to support Manitobans with affordable, safe housing, including seniors, and including, folks who are struggling with their mental health, including folks who are struggling with substance use, including folks who are, have affordability issues. This is a government who is going to show up each and every day and meet people where they're at and provide supports and services. And we're not going to, not provide services like the former failed PC government did and leave housing into disrepair to the point where it has to be demolished. This is a government who's going to show up each and every day and listen to residents, listen to their needs, respond to what's going on in their residence, and meet the needs of the residents. We have, made security upgrades. We've hired back security guards. We've hired back tenant service coordinators. We've hired back maintenance workers, and we're going to continue to, support our folks on the front lines, because they are on the front lines supporting these folks to ensure that they are successfully tenanted. And we know that folks have, needs. That sometimes folks, there's a breakdown in tenancy. It's Mental Health Week this week. And everybody, there's not one person in all of Canada who has not, struggled with their mental health. And, tomorrow someone might have a mental health break. And, a tenant service coordinator is going to be there to support them through that. And they're going to be there to, they might be that person that's going to help them through that, to navigate to the supports that they need. Our security are there each and every day. There's a number for someone to call if they need their supports and services. Under the former failed PC government, they were firing those security guards that are on the front lines that are helping and to support. There were SWAT teams rappelling off of our Manitoba housing buildings almost monthly because of the failed former PC government not supporting and ensuring that residents were supported well. And, we're working closely with, our policing, but we're also working in supporting our residents to making sure that they are supported well in their tenancy, and we're going to continue to do that.
The honourable member for Portage.
Just before we close, as we are going to close, I just want to say it's entirely inappropriate to put false personal attacks on the record. I would ask the minister to retract her baseless comments and accusations that I missed a meeting in February at Oak Tree Towers. The only time I'd missed a meeting ever at Oak Tree Towers was if when I was tossed out by Manitoba Housing, and when I was asked by Manitoba Housing to leave because they said they wouldn't conduct a fire drill meeting with the folks in the building, and because it was a safety issue, I left. The only other time that we've ever moved a meeting was if we moved a meeting. I have never missed a meeting with that. In saying that, I will close this meeting at this time. We had a ton of questions left, but let's close.
The honourable minister in response to
Question the resolutions.
Seeing no further questions, we'll now put the question to the resolution. Resolution 24.2, resolved that there be granted to His Majesty a sum not exceeding $53,337,000 for housing, addictions, and homelessness, mental health, and addictions for the fiscal year ending March 31, 2027. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.3, resolved that there be granted to His Majesty a sum not exceeding $267,782,000 for housing, addictions, and homelessness, the Manitoba Housing and Renewal Corporation for the fiscal year ending March 31, 2027. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.4, resolved that there be granted to His Majesty a sum not exceeding $104,242,000 for housing, addictions, and homelessness, physician services, psychiatry for the fiscal year ending March 31, 2027. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 24.5, resolved that there be granted to His Majesty a sum not exceeding $322,458,000 for housing, addictions, and homelessness funding to health authorities for the fiscal year ending March 31, 2027. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 24.6, resolved that there be granted to His Majesty a sum not exceeding $820,000 for housing, addictions, and homelessness costs related to capital assets of other reporting entities for the fiscal year ending March 31, 2027. Shall the resolution pass?
Pass.
Resolution is accordingly passed. Resolution 24.7, resolved that there be granted to His Majesty a sum not exceeding $21,700,000 for housing, addictions, and homelessness loans and guarantees programs for the fiscal year ending March 31, 2027. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 24.8, resolved that there be granted to His Majesty a sum not exceeding $78 million for housing, addictions, and homelessness, other reporting entities, capital investment for the fiscal year ending March 31, 2027. Shall the resolution pass?
Pass.
The resolution is accordingly passed. The last item to be considered for the estimates of this department is item 24.1A, the minister's salary contained in resolution 24.1. At this point, we request that the minister's staff leave the table for the consideration of this last item. The floor is open for questions.
But they need to leave first.
Oh, we'll wait till they depart. The floor is open for questions. Seeing none. Resolution 24.1, resolve that there be granted to His Majesty a sum not exceeding $7,390,000 for housing, addictions, and homelessness, finance, and corporate services for the fiscal year ending March 31, 2027. Shall the resolution pass?
Pass.
The resolution is accordingly passed.
This complete.
This completes the estimates of the Department of Housing, Addictions, and Homelessness. The next set of estimates to be considered by the section of the Committee of Supply is the Department of Business, Mining, Trade, and Job Creation. The hour,
59.
the hour being 4:59. What is the will of the committee?
Rise.
Recess. 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 Yeah, committee recess.
The committee recess.